we are now going to the next part, that is tumors. Tumors of the bone. Okay. See, normally tumors can arise from either from an epithelial cell, or it can arise from cells of the connective tissue. If an tumor arises from the epithelial cell, it is called as carcinoma. If a tumor arises from a connective tissue, it is called as sarcoma. Bone is a connective tissue, so the bone tumors are sarcomas. Okay. Any tumor, it is divided into two broad categories. One is benign tumor, another one is malignant tumor. Benign tumor, it does not spread anywhere. But malignant tumors are aggressive tumors. They are usually aggressive tumors. They spread to other parts of the body, which we call as metastasis. Okay, benign tumors will not spread anywhere, whereas malignant tumors are aggressive tumors. They spread to different parts of the body. So the metastasis to different parts of the body. Now there is another entity in bone tumors which are called as locally aggressive tumors. What is this locally aggressive tumors? These are actually benign tumors only. They won't malignant, but at local site they cause severe destruction. Example is giant cell tumor. GCT. Example is giant cell tumor. Okay, example is giant cell tumor. Now, with this background, we will go into the further details of bone tumors. Now, this diagram will tell you the parts of the bones. As we already know, this is called as the epiphyseal region, and there is a plate here called as the epiphyseal plate, and then this region is called as metaphyseal region, and this region is called as diaphyseal region. Why we are again coming to this topic is certain tumors are common in certain areas. Okay, so we'll see what are the tumors which are common in these areas. In the epiphyseal tumor, two tumors are common. One is called as giant cell tumor. The another one is called as chondroblastoma. Chondroblastoma is usually seen in children. Giant cell tumor is usually seen in adults. Okay. So epiphyseal region. In the epiphyseal region, two tumors are common. One is called as giant cell tumor. Another one is called as chondroblastoma. Chondroblastoma is seen in children. Giant cell tumor is seen in adults. Okay. Clear? Now coming to the metaphyseal region, there are a number of tumors that occurs in the metaphyseal region. Few examples are: one is osteosarcoma, which occurs in the metaphyseal region. Simple bone cyst or unicameral bone cyst, What is the most common type of hip dislocation? Posterior. Okay. What is the nerve which is commonly injured in posterior hip dislocation? Sciatic nerve. Okay, very good. Sciatic nerve. What is the attitude that will occur if a patient has got posterior dislocation? Attitude of the limb if he has a posterior dislocation. What is the mnemonic I told? FADIR, FADIR. What does FADIR stand for? Flexion, adduction, and internal rotation. Okay. If the patient has got anterior dislocation, what is the attitude of the limb? Faber. F stands for flexion, abduction, and external rotation. What is one more condition where we will get Faber attitude? Faber attitude. What is the one more condition where we will get Faber attitude? TB, first stage of TB hip we will get. So the tumors which are common in metaphyseal region are osteosarcoma, simple or unicameral bone cyst, aneurysmal bone cyst, then non-ossifying fibroma, So these are few tumors which are common in the metaphyseal region. And in the diaphyseal region, the tumors which are common are Ewing's sarcoma, osteoid osteoma, and adamantinoma. So these are the tumors which are common in this diaphyseal region. In the metaphyseal region, you can also add one more tumor which is common, that is osteochondroma. Okay, clear? So based on the location of the tumor in the bone, we can identify the tumor easily. Okay, so if a tumor occurs in the epiphyseal region, it will be mostly giant cell tumor or chondroblastoma. If a tumor occurs in the metaphyseal region, it will be one of these. If a tumor is seen in the diaphyseal region, it will be one of these tumors. Okay, so the location of the tumor is very, very important. Again, MCQs are asked based on this also. For example, all of the following tumors occurs in the diaphyseal region except they will give Ewing's sarcoma, adamantinoma, osteoid osteoma, and they will give osteochondroma. So the answer will be osteochondroma. Okay, clear? So MCQs can come like this. Most frequently asked topic in this region. Okay. Now we'll go and see the individual bone tumors, and we'll start first with benign bone tumors. The first benign bone tumor what we see here is osteochondroma. Osteochondroma is seen in the children's. It is seen in the metaphyseal region. Now, what is osteochondroma? If you take the bone, we all know in the children's there is a plate here called as epiphyseal plate, and this epiphyseal plate is made up of cartilage. From the cartilage, a bony outgrowth starts. So the growth of this is called as osteochondroma. So the cartilage, the epiphyseal plate grows outside the bone. Okay, the epiphyseal plate grows outside the bone. Such a tumor is called as osteochondroma. Usually this osteochondroma will be covered by a cartilaginous cap. If this cartilaginous cap is more than 2 centimeter thickness, chances of this getting converted into malignant tumor is more, which can convert into chondrosarcoma. Okay, clear? Okay, so very simple. What is osteochondroma? So there is a plate here called as epiphyseal plate, which is made up of hyaline cartilage. When this cartilage grows outside the bone, what is the role of epiphyseal cartilage? It has to grow within the bone, and it has to increase the size of the bone, length of the bone. Instead of doing that, if it grows outside the bone, then the tumor is called as what? Osteochondroma. Usually this osteochondroma will be covered by a cartilaginous cap, and this cartilaginous cap is usually more than 2 centimeters, usually less than 2 centimeter thickness. If it is more than 2 centimeter thickness, it can go in for malignant transformation. And what malignant tumor it can produce? It can produce chondrosarcoma. So this tumor can be either sessile, that is without stalk, or it can have a stalk. So that is called as pedunculated type. And what problem it can cause? When it compresses over the bursa, or when it compresses over a nerve, it can cause pain. So surgery is excision, Surgery is excision of the tumor. Surgery is how you are going to treat it. You can remove the tumor. That's all. That is called as the excision. Very simple. Clear? That is called as excision. So osteochondroma carrier messages very important. It occurs in the metaphyseal region. It is covered by a cartilaginous cap. All these are important points. Okay, clear? Though it arises in the metaphyseal region, it grows towards the diaphyseal region. Direction on the other note you all diaphyseal note you all. But it arises from the metaphyseal region. It arises from the metaphyseal region. So this is one benign tumor. So there is a picture here. I will show you. Can you able to see this? So you can see the bone growth outside. Okay, so usually there will be a cartilaginous cap here. In X-ray you can't see the cartilage. So usually there will be a cartilaginous cap here. And this bone which is growing out will have a cavity, and this cavity will be continuous with the medullary cavity of the bone. So the cavity in the osteochondroma will be continuous with the medullary cavity of the bone. Okay, so this is how an osteochondroma will appear. Just imagine if there is a nerve which is running here, it can compress the nerve. If it compresses the nerve, you will have pain, severe pain. So if you have pain, you will cut this bone and remove it. So that is called as excision. That is called as what? Excision. Okay, clear? Fine. So with this, we are going to the next part of the benign tumors. That is called as enchondromas. Enchondromas. Okay, what is called as an enchondroma? Just opposite to what we saw now. Just now what we saw, the cartilage is growing outside the bone. If there is a bone and if the cartilage is within the bone, and if the cartilage is within the bone, chondro means cartilage, en means inside. So enchondroma means cartilage within the bone. So the cartilage within the bone is called as enchondroma. Cartilage within the bone is called as enchondroma. Enchondroma is most commonly seen in bones of the hand region. Bones of the hand region usually have enchondromas. Bones of the hand region usually have enchondromas. You treat the enchondromas by curettage. You treat the enchondromas by curettage. And this enchondromas can occur in multiple manner. So that is called as multiple enchondromatosis. And that is called as multiple enchondromatosis. So it can occur single or it can occur in multiple ways. Multiple bones it can involve. Once it occurs in multiple bones, then it is called as multiple enchondromatosis. When multiple enchondromatosis is associated with hemangiomas, and when it is associated with phlebolith, phlebolith means formation of stone within the veins, it is called as phlebolith. Okay, so when the multiple enchondromatosis is associated with hemangioma and phlebolith, then this condition is called as Maffucci syndrome. This condition is called as Maffucci syndrome. Okay, there is another condition where multiple enchondromas can occur. That is called as Ollius disease. That is called as Ollius disease. Usually enchondromas are benign tumors. Usually enchondromas are benign tumors. Very simple, very important. They are benign tumors. But if it occurs in Maffucci syndrome, there is 100% chances of malignancy. There is 100% chances of malignancy. In Ollius disease, there is 30% chances of malignancy. In Ollius disease, there is 30% chances of malignancy. Okay, clear? Do you understand what is enchondromas? See, chondroma means cartilage. When it occurs within the bone, then it is called as enchondroma. Cartilage islands within the bone is called as enchondromas. So usually enchondromas occurs in a solitary manner, but if it occurs in a multiple manner, we call that as multiple enchondromatosis. And this multiple enchondromatosis, when it is associated with hemangioma and phleboliths, then it is called as Maffucci syndrome. The other syndrome where you can get multiple enchondromatosis is Ollius disease. What is the importance of Maffucci syndrome? There is 100% chances of malignant transfer. Very important. There is 100% chances of malignant transfer. Okay. Phlebolytic means formation of stones within the venous system. Formation of calcified bodies within the venous system is called as phlebolytics. Okay. Phlegbo means vein, lith means stone. So this is about enchondromas. So we'll see if there is a picture. Yeah. So if you see here, this is the bones of hand. Elia, what bone is this? Which phalanx it is? Proximal phalanx. Proximal phalanx. Within the proximal phalanx, you can see the cartilage island here. So this is called as enchondroma. This is called as enchondroma. So within the bone, you get cartilage islands. That is called as enchondroma. Okay. Next, we will go to the next benign tumor, which is commonly asked in exam as osteoid osteoma. Osteoid osteoma. Osteoid osteoma usually affects the diaphyseal region. Usually affects the diaphyseal region of the bone. And if you take a bone, let us consider this is the bone, and usually osteoid osteoma affects the proximal femur. Usually osteoid osteoma occurs in the proximal femur, and osteoid osteoma is seen in the cortical region or the cortex of the bone. It is seen in the cortical region of the bone. So usually proximal femur, in the cortex it produces a swelling like this. This swelling is called as osteoid osteoma. This is called as osteoid osteoma. If you take a CT of osteoid osteoma, you can see a central sclerotic area surrounded by an lytic area. So the central sclerotic area is surrounded by an lytic area. So that is called as nidus. Okay, if the nidus is greater than 2 centimeter, then the tumor is called as osteoblastoma. Okay, clear? So what is osteoid osteoma? This is a tumor which is commonly seen in diaphyseal region. Most common bone which is involved is proximal femur, and that too it involves the cortex of the proximal femur. Normally it is surrounded by a lucent area. That lucent area is called as nidus. This nidus contains osteoblast. If this nidus is more than 2 centimeter in size, then the tumor is called as osteoblastoma. And this osteoblast will produce prostaglandins. Prostaglandins will cause severe pain. Hence, if you give aspirin for this patient, the pain will come down. The pain will settle because aspirin acts against prostaglandins. Very, very important point. Osteoid osteoma produces prostaglandins, and these prostaglandins are mostly produced in the night time, so there is more chances of night pain. So this night pain can be treated easily with aspirin, because aspirin are against prostaglandins. They act against prostaglandins. So this is about osteoid osteoma. What is the treatment modality for osteoid osteoma? Radio frequency ablation is the treatment. So next, if there is a picture, yeah. See, you can see here. This is the tumor. This is the osteoid osteoma. You can see the central sclerotic area surrounded by a lytic area. So this is in CT film showing clearly the osteoid osteoma. Clear? So this is how it will appear in the CT. Now the next tumor which is commonly seen are the bone cyst. Okay. So the bone cysts are usually solitary, that is simple or unicameral bone cyst. Most commonly involves the metaphyseal region. And that too most commonly involves the proximal humerus. When a tumor occurs like this, it's a bone cyst, so it will have a thin cortex outside. Pathological fractures are very common in this. So sometimes what happens is, when the fracture happens, the fracture fragments fall within the cyst. gives a sign called as fallen leaf sign. Gives a sign called as fallen leaf sign. Okay. So in unicameral bone cyst, the cortex will be very much thinned out. The thinned out cortex can break and the broken part can fall within the bone cyst. Such a sign is called as fallen leaf sign. Such a sign is called as fallen leaf sign. I'll show you a picture also. There is a picture I'll show you. Okay, so this is a simple bone cyst which is involving the proximal femur, and you can see the fracture which is happening here. The fracture has happened here, and this kind of fragments, you can see a fragment here. Can you see a fragment here which is protruding, and this fragment can fall down. So such a sign is called as fallen leaf sign. So such a sign is called as fallen leaf sign. So this is a classical unicameral bone cyst. It involves the proximal humerus. You can see the bone becoming very much thinned out. When the bone gets thinned out, fractures are common. So pathological fractures are common, and the fracture fragment falls within the cyst. So that is called as fallen leaf sign. How you treat it? Mostly it heals by itself. There is no need for any surgery. It heals by itself. Unicameral bone cyst usually heals by itself. Okay. So next benign tumor, what we see commonly is aneurysmal bone cyst. Aneurysmal bone cyst also involves the metaphyseal region commonly. Metaphyseal region commonly. And what is the difference between unicameral bone cyst and aneurysmal bone cyst? In aneurysmal bone cyst, you will see multiple fluid levels. You will see multiple fluid levels. So in aneurysmal bone cyst, you will see multiple fluid levels. Okay. So all this arrows indicates fluid levels. So you can see multiple fluid levels within the cyst. So in aneurysmal bone cyst, you will see multiple fluid levels. That is the difference between the unicameral bone cyst and the aneurysmal bone cyst. Okay. Now the next common tumor which we see is fibrous cortical defect. Fibrous cortical defect. What does fibrous cortical defect mean by? The location or the presence of fibrous tissue in a bone is called as fibrous cortical defect. So usually bone has a strong structure. Instead of bone, if you have a fibrous tissue in that area, then that is called as fibrous cortical defect. A fibrous cortical defect can be seen in only one bone, then it is called as monoosteotic. If it's seen in multiple bones, then it is called as polyosteotic. When this polyosteotic fibrous cortical defect is associated with precocious puberty, if it is seen with precocious puberty, and if it is seen with Kefauver spots, then that condition is called as McCune-Albright syndrome. McCune-Albright syndrome. So what is fibrous cortical defect? The presence of a fibrous tissue in a bone is called as a fibrous cortical defect. Just imagine if a fibrous tissue is there in the bone will be strong or it is weak. It will be weak. So it is more prone for fractures again. And if this is seen in only one bone of the body, then that is called as monoosteotic. Mono means single. It's seen in only one bone. Sometimes it can involve multiple bones. If it involves multiple bones, then it is called as polyosteotic. When there is a polyosteotic fibrous cortical defect, and if the patient has got precocious puberty and Kefauver spots, then that syndrome is called as McCune-Albright syndrome. Usually fibrous cortical defect is seen in proximal femur. Where they form a deformity called as Shepherd-Crook deformity. Where they form a deformity called as Shepherd-Crook deformity. Shepherd-Crook deformity. Where they form a deformity called as Shepherd-Crook deformity. Yes. So you can see here, this is a monoosteotic form. This is a monoosteotic form seen in an X-ray, which is involving the proximal femur, and the femur, because of the fibrous cortical defect, is bent like this. You know, shepherd na theriyumla? Those who rear cattle, they have a stick in their hand which is bent. So that is called a shepherd-Crook deformity. That is called a shepherd-Crook's deformity, which is seen in fibrous cortical defect. If you see this patient, he has got a discoloration in his chest. This is called as scapulae spots. This is called as scapulae spots. So when scapulae spots is there, and along with scapulae spots, if he has got precocious puberty and polyostotic fibrous cortical defect, then what is the condition called as? That is called as McCune-Albright syndrome. That is called as McCune-Albright syndrome. So next common tumor, which is locally aggressive tumor, is giant cell tumor. Very, very important, giant cell tumor. So giant cell tumors are locally aggressive tumors. They involve the epiphyseal region, most commonly seen in adults between 20 to 40 years of age. In 20 to 40 years of age, giant cell tumors are seen. It involves the epiphyseal region, and from there it can extend to the metaphyseal region also. From the epiphyseal region, it can extend to the metaphyseal region also. This tumor can cause local destruction. This can cause local destruction. Giant cell tumor arises from a group of cells called as osteoclast. So osteoclast joins together to form the giant cells. So giant cell tumors, the cell origin for this is osteoclast. Before the tumors, what we saw are all related to cartilage cells and the osteoblast cells, but giant cell tumor is related to this cell. What is the cell? This is osteoclast cell. Yesterday we saw about osteoclast. What is the function of osteoclast? It resorbs the bone. So that is why it is aggressive. That is why it destroys the bone easily. It is a locally aggressive tumor. So these giant cell tumors are produced from osteoclast, and you treat the giant cell tumors by curettage plus bone grafting. Curettage plus bone grafting, because it destroys most of the bone there. So after you remove the tumor, you put bone graft there for stability and healing of the bone. So curettage plus bone grafting is the treatment of choice for giant cell tumor. So these are the various benign tumors. I will show you a giant cell tumor picture. Yes, you can see the giant cell tumor. This is the tumor which is destroying the cortex. Though it is a benign tumor, it is locally very aggressive. Most commonly seen in distal femur. Followed by proximal tibia, followed by distal radius. Keep this in mind. If they give a swelling in the distal radius, if you think that is the malignant swelling, then it will be 99% giant cell tumor. Distal radius, malignant swelling, it will be giant cell tumor. Clear? So giant cell tumor are most commonly seen in these bones. So distal radius is one site where you can see the giant cell tumor frequently. Okay. So we'll go to the next part of tumor, that is malignant tumors of the bone. In malignant tumors of the bone, we'll see two important tumors. One is osteosarcoma. Osteosarcoma, also called as osteogenic sarcoma. Which means these are bone producing tumors. These are bone producing malignant tumors. Sarcoma means malignant. Okay. So bone producing malignant tumors. Now this osteosarcoma can be of two types. One is primary osteosarcoma, or it can be secondary osteosarcoma. Primary osteosarcoma occurs without any cause, idiopathic. There is no cause for it, but it arises. So that is called as primary osteosarcoma. Secondary osteosarcoma occurs in a diseased bone. Like Paget's disease, or a bone which is irradiated, or a bone which is irradiated, or a bone where there is chronic osteomyelitis. So in these conditions, osteosarcoma can arise. So if a osteosarcoma arises secondary to a disease condition like Paget's disease, or an irradiated bone, or with a chronic osteomyelitic bone, and that is called as secondary osteosarcoma. That is called as secondary osteosarcoma. Now, osteosarcomas are commonly seen in second decade. So, tumors which are commonly seen in second decade of life is osteosarcoma. Osteosarcoma most commonly involves a metaphyseal region, that is distal femur is the most common site, followed by proximal tibia. Followed by proximal tibia. So osteosarcoma is most commonly seen in distal femur followed by proximal tibia. Distal femur followed by proximal tibia. Okay. Now whenever there is osteosarcoma, the patient can present with pain. The patient can present with swelling. Okay. So all this occurs very rapidly. You can diagnose osteosarcoma by taking X-rays. In an X-ray, the patient will have sunray or sunburst appearance. Now, what is this called a sunray or sunburst appearance? Now, let us consider this is a bone. This is a distal femur. We all know in pediatrics, the bone is covered by a thick periosteum. Now, when a tumor occurs in the metaphyseal region, it spreads very rapidly, and it lifts off the periosteum. So, when it lifts off the periosteum, it gives a ray-like appearance. So, this is called a sunray appearance. Now, when the periosteum is lifted, you get a triangle-shaped area here. That is called as Codman's triangle. So, if you see Codman's triangle, if you see sunray appearance or sunburst appearance in an X-ray of a child, the most common diagnosis is osteosarcoma. Very, very important point. These are frequently asked questions. Sunray appearance or sunburst appearance or Codman triangles are seen in osteosarcoma. Osteosarcoma is a malignant tumor of the bone. Okay. Now you can also take an MRI to diagnose osteosarcoma and to also identify the extent of the disease. How much it has spread to the surrounding, you can diagnose that with MRI. Always tissue diagnosis, that is histopathological diagnosis, is the gold standard to confirm a tumor. Okay. And once if you confirm it is osteosarcoma, you have to give 3 kinds of therapy. One is called as neoadjuvant chemotherapy. To put it very broadly, there are 3 broad treatments for any malignancies. One is called as chemotherapy, another one is called as radiotherapy, another one is surgery. What is chemotherapy? You give drugs to control the tumor, then it is called as chemotherapy. You give radiation to control the tumor, it is called as radiotherapy. You excise the tumor, it is called as surgery. So these are the basic modalities of treatment for any tumors. For osteosarcoma, you have to give neoadjuvant chemotherapy. What is called as neoadjuvant chemotherapy? Before doing surgery, you give chemotherapy to reduce the size of the tumor. So neoadjuvant chemotherapy is given before surgery to reduce the size of the tumor and to control the tumor. And then you plan for surgery. So you remove the tumor after its size decreases, and then again you give chemotherapy, that is called as adjuvant chemotherapy. Adjuvant chemotherapy is given after surgery. Neoadjuvant chemotherapy is given before surgery. Okay. So what are the drugs which are commonly used in chemotherapy for the osteosarcoma? You can keep this mnemonic as CMDA. CMDA, you know, la? Embedded. Okay, so CMDA. C stands for cyclophosphamide. C stands for cyclophosphamide. M stands for methotrexate. M stands for methotrexate. D stands for doxorubicin. D stands for doxorubicin. A stands for actinomycin. So these are various drugs which are used in treatment of osteosarcoma. So since we use drugs to treat, the treatment is called as chemotherapy. If you give chemotherapy before surgery, it is called as neoadjuvant chemotherapy. If you give chemotherapy after surgery, it is called as adjuvant chemotherapy. It is called as adjuvant chemotherapy. Okay. So this is about the treatment of osteosarcoma. Remember in mind, osteosarcomas are radio-resistant tumor. Osteosarcomas are radio-resistant tumor. So if you give radiation, it will not work in osteosarcoma. They are highly radio-resistant tumors. They are highly radio-resistant tumors. Okay. You see this diagram. Okay. So you can see a diffuse swelling which is seen here, and the periosteum is lifted from here to form a triangle shaped area. So what is this triangle called as? This is called as Codman's triangle. And also if you observe very closely, you can see very thin lines running across the periosteum to the cortex like this. So this appearance is called as sun ray or sunburst appearance. This is called as sun ray or sunburst appearance. So these two questions are frequently asked: sun ray appearance or sunburst appearance, or if it is in Codman's triangle, the diagnosis is first diagnosis is osteosarcoma. First diagnosis is osteosarcoma. Okay. So we'll move to the next important malignant tumor, that is Ewing sarcoma. That is Ewing sarcoma. The Ewing sarcoma. So now Ewing sarcoma, from which cell it arises? It arises from round cells. It arises from round cells. So the cell of origin is round cells. Cell of origin is round cells. It is most common tumor of first decade. Most common tumor of first decade. Though the most common tumor of first decade, its presentation is seen in second decade. It usually presents in second decade. It arises, though it arises in first decade, the presentation is usually seen in second decade. It involves the diaphyseal region. It involves the diaphyseal region of the bone. It involves the diaphyseal region of the bone. Whenever a patient has got Ewing sarcoma, he can present with fever. He can present with fever. When you see his cell count, the WBC count will be elevated. ESR will be elevated. ESR will be elevated. Okay. Have you come across anywhere where fever, increased WBC and increased ESR seen in the morning? Since morning we have crossed some few topics. Anywhere did you cross a condition where the patient presents with fever, increased the WBC and increased the ESR or increased the CRP? Anywhere you saw? No? What is it? Osteomyelitis. Very good. Ewing sarcoma mimics like osteomyelitis. It mimics like osteomyelitis. Very, very important. You will be misguided that the patient has got osteomyelitis, but you would have a very severe condition, that is osteosarcoma. So Ewing sarcoma will appear like osteomyelitis, but you have to be very careful in diagnosing Ewing sarcoma. Okay, clear? It affects the diaphyseal region, and the patient will present to you with fever, increased WBC count and increased ESR. You might think the patient is suffering from osteomyelitis, but he might land up in having Ewing sarcoma. You might land up in having Ewing sarcoma. So this is very, very important. So once a patient has got Ewing sarcoma, he requires treatment in the form of radiation. Radiation will work in Ewing sarcoma, or you can give chemotherapy, or you can give surgery, or you can do surgery also to treat this tumor. So all these things will work in Ewing sarcoma. Radiation, chemotherapy, surgery, anything you can give for Ewing sarcoma. The carry-home message from this is the cell of origin is round cell. The patient will present with features looking like osteomyelitis. When you take an X-ray of this patient, if this is bone, the periosteum will form thickening like this. Okay. What does the periosteum look like in osteosarcoma? How does the periosteum reaction look like in osteosarcoma? What is this appearance called as? Sundray appearance. And this is called as, in Ewing sarcoma, the periosteal reaction is called as onion peel appearance. Onion peel appearance is the periosteal reaction which is seen in Ewing sarcoma. Is the reaction which is seen in Ewing sarcoma. Okay, clear? It's a very, very important point. See, all these periosteal reactions are again frequently asked questions. So if you see an onion peel appearance in periosteal reaction, then the diagnosis is what? It is Ewing's sarcoma. Okay. Now we'll go to the next part of called as multiple myeloma. Multiple myeloma, again it affects the bones, and it most commonly affects the axial skeleton. The spine is most commonly affected by multiple myeloma. The cell of origin for multiple myeloma is plasma cells. Okay, multiple myeloma, the cell of origin is plasma cells. You diagnose multiple myeloma by doing a urine test where you look for Benz-Jones protein. You do a urine test to look for Benz-Jones protein, and that will be positive in multiple myeloma. The ultimate diagnosis is serum electrophoresis. And you treat the multiple myeloma by giving chemotherapeutic agent. Okay, by giving chemotherapeutic agents. So these are few topics which we have to see in malignant tumors. Okay, so with this we are done with tumors. So we can stretch for 5 minutes, then we can go to the next topic.